up about universal health care. They spend an eternity on it, which is ironic given the fact that the difference in their plans is about this much. Here is Hillary trying to explain it.
For example, it's been unfortunate that Senator Obama has consistently said that I would force people to have health care whether they could afford it or not.
Okay, I guess it's only unfortunate because it's true. Under Hillary's plan, every single man, woman, and child in this country would be forced to buy health care. That's the facts. I mean, why she's trying to cover that up is beyond me, considering that minutes later, she launched into an explanation as to why history proves mandatory government programs are such a great thing.
And in fact, it would be as though Franklin Roosevelt said, let's make Social Security voluntary. Let's let everybody get in it if they can afford it. Or President Johnson said, let's make Medicare voluntary.
Oh my, imagine if we were to have those two massive government programs that have been so mismanaged to the tune of trillions of dollars in unfunded liability. Imagine if you would only have to opt in or out of that. My gosh, America might actually not be up for sale to the Chinese today. Oh, the humanity. But that's how these progressives think. Our financial well-being is just some sort of a minor nuisance. I mean, we can print more, and we're taking care of people that can't take care of themselves. But is that even really true? You hear these politicians on TV all the time say there's 47 million uninsured people in America. The real story is a good number of these people choose to be uninsured. I learned this in the New York Times last week. About a third of those people come from households that make at least $50,000 a year. Those people can afford coverage if they wanted it. They've just decided they'd rather spend their money elsewhere. Remember, the entire concept behind insurance is that honestly, I think it's like legalized gambling. Insurance companies are betting that you're not going to get sick. If you choose to not buy insurance, you're betting on the same thing. You can say what you want about that decision. I personally think it's stupid. But when I was 20, I did it too. The point is, it's your decision to make. I'm all for affordability. But ask yourself, which government program exactly has been effective at making things more affordable? I mean, let's look to France, shall we? Oh, they beg, oh please, give me government health care. And they got it. Now, 90% of the country also has to buy private health care to pay for everything that the government health care doesn't cover. So I guess we can only dream of the day when we have two insurance premiums instead of one. Michael Tanner is the Director of Health and Welfare Studies at the Cato Institute. Michael, this is insanity. First of all, let's talk about Massachusetts. Massachusetts just did this. They put it in. Mitt Romney was part of it. They can only force about half of the people into it, and they're fining people now $1,000 if you don't get into it.
Well, that's right. The two plans are very much alike. In fact, Jonathan Gruber for MIT was the advisor to Mitt Romney on this. He was also Hillary Clinton's advisor.
Perfect.
Both plans would mandate that you have to buy health insurance, and neither one has come close. The Massachusetts plan, about half of all the people who were previously uninsured chose not to sign up despite the mandate. And in fact, of the people who signed up, almost all of them had their policy at least partially paid for by the government. Almost nobody who was unsubsidized signed up.
Okay, so, I just want to be, this is going to sound horrible, but it's the truth, America. If you have the money to get it, and you decide not to get it, why should I then take care of you? It's like, for instance, you have fire insurance because if your house burns down, the bank doesn't want to be on the hook for it. Car insurance, you're going to wipe somebody else out. But when it comes to health insurance, hey, fatty, fatso, you want to eat all the Oreo cookies and marshmallows you want, go ahead and do it without health insurance, but I ain't paying for the fireman to come cut a giant hole on the side of your wall and drag your fat ass to the hospital. Not my responsibility.
Well, we do have a society that says, look, I'll pay for the fries, you pay for the Lipitor.
Right. That's crazy talk. Why am I responsible for paying for that? If you choose to make those choices and live your life that way, oh well.
And the problem becomes that once we socialize the cost, it gives the government the right to step in and start monitoring our behavior. It says, since we're going to have to pay for your bad health through our healthcare system, we can tell you what to eat, whether or not you smoke, how much you have to exercise, and so on.
You know what? I'm never going to qualify for health insurance if they start doing that. I just never, because I'm not exercising. And you know what? If I have a heart attack, my fault. Michael, thanks a lot. Now, whether or not our healthcare system needs reform isn't the question. Of course it does. It stinks on ice. The real question is whether the government is the institution that should be in charge of that reform. The people who say, oh, yes, yes, they always point to countries that already have universal government-run health care as shining examples of what they can become. Really? I lived by the Canadian border. I know. They say, look at the UK then. Don't look at Canada. Oh, it's utopia over there. Free health care for everybody. It's like candy in the streets. And people live to be 297 years old. Really? The real story is these proponents simply have fallen victim to the grass is always greener syndrome. Progressives never will advertise this. But every country around the world with universal health care is having their own share of problems. In fact, in the UK, wait times in emergency rooms had gotten so high that the government had to come in and fix the problem that they created. They stepped in and said, we are going to pass a law to guarantee that you go to a hospital, you will definitely see a doctor within 4 hours. Wow. Shooting for the stars. Great idea, except the regulations that they just did now created loopholes. And you know that. Look at our tax code. So providers got around the rule by keeping patients not in the hospital, but in the ambulance, parked outside of the hospital until they were sure they'd be able to be seen within the government's 4-hour limit. It's called patient stacking. And in some cases, it's resulted in seriously ill patients waiting an eternity only in an ambulance, to only then go inside and wait another 4 hours. Some people as long as 9-hour waits. But the government guarantees you'll be seen by a doctor in 4. The patient stacking has another side effect. Ambulances that are needed for other calls are stuck idling outside hospitals. That's causing massive delays in response. In some cases, like a 16-year-old boy had leukemia. Doctor kept calling, where's the ambulance? Where's the ambulance? Waited 2 hours for the ambulance to take him 300 yards. Unfortunately, it meant death to that 16-year-old. Now, the delays are not exactly rare in the United Kingdom. 44,000 people sitting in front of a hospital were reported in the last 15 months. I gotta tell you, our system may not be perfect, but if you're willing to take an honest look around the world, you'll realize really nobody's system is perfect. We're pretty close. If you think the grass is greener around the world, it's only because they're using taxpayer dollars as fertilizer. And unfortunately, our politicians are fertilizing with something my grandfather used to call bullcrap. Helen Rainbow is a senior research officer at Doctors for Reform in England. Let's just start with this. You guys have a color-coded system for hospitals on whether or not they can take any more people. For instance, what does black alert mean?
I think basically that means that hospitals can't take any more patients unless they're absolute emergencies. So patients will go to hospitals, other hospitals in the area. Okay,
so you've got a color code. We can't even handle this, the Homeland Security color code system. Hospitals say it's a black alert, so you can't go into the hospital because it's too crowded. We're having a problem with overcrowded hospitals here. Why, with your universal health system, are hospitals more crowded? Why aren't there any beds available in this utopian society?
I think we have real problems, with a centrally imposed system. You mentioned the example of targets, which, basically are the ways that the government's trying to control the system and trying to bring down waiting times, etc. But the problem is, many places will try and kind of play around those targets, which has led to some of the the thing that you were talking about, right. Patient stacking.
But you also have, and who would have seen this coming, when you got a government program and then the unions involved, there's nothing that could go wrong there. You also have, the doctors have negotiated union rules now that there's no real incentive for them to work at night. Is that true?
Yeah, that's true for kind of local practice, general practitioners, primary practitioners. Due to the new contracts that were negotiated a few years ago, there's really a kind of lack of incentives for doctors to cover out-of-hours care, which has led to an increased number of admittances to emergency departments, which is adding to this problem.
It's my understanding that it is your belief that your system, is just poorly run, but a government-run system could be good. I mean, doesn't government program and poorly run go hand in hand every time? How can you have a government-run program that works?
I think, the problem with our system is that it's very much centrally imposed. What we would be calling for is a much more kind of localised system where actually the power is kind of right down to the level of the consumers and they're driving the system, whereas at the moment it's very much top-down, which is leading to these kind of real issues that we're seeing.
Right. So a little closer to the consumer. Oh, it's almost, what's that called? Like private healthcare almost. Maybe not.
I think we...
No, go ahead.
I think we kind of look... I was just going to say, I think we're kind of looking for a system where actually, money is much responsive to individuals, still a national system,
right.
Well, still a kind of paid for by the taxpayer, but as opposed to kind of responding to top-down levels, it's responding to kind of what individuals want.